Hi, I'm Debbie from MedStrom. I'm a member of the clinical team. We understand at the moment it's very difficult for us to gain access to help deliver training in the wards. We also understand that it's incredibly busy on the wards. So what we've tried to put together for you is a quick bite-sized 5 points in less than 5 minutes to help you. When we breathe, our rib cage comes up and out. Tidal volume is the amount of air that is exchanged as we breathe, and this is normally about 500 mils. 78% of tidal volume is achieved by the movement of that rib cage up and out. When we're supine, this drops over half to about 32%. If a patient is scrunched for too long, this can develop long-term contractures and restrictive pulmonary disease. Residual volume is the amount of air that's left in the lungs after we have forced the air out. Typically, this is about 1.5 liters, but when we are supine or the lungs are restricted, this residual volume decreases, which increases the risk of portions of the lungs collapsing. Several studies have shown that prolonged bed rest can increase the risk of respiratory tract infection. This is because it's not as easy for us to cough, or we can't cough, which means that we can't clear irritants in the lungs, and also because of pooling of secretions and mucus in the lungs. Frequent repositioning can help to distribute that abnormal pooling of mucus in the lungs and also reduce the risk of respiratory tract infection. We could either do this manually or we could use lateral tilt to assist us. If we want to use lateral tilt functions on the Eleganza 5, we can use it either on the caregiver interface here or on the pedals below. With either method, we would use green to go, followed by the tilt mechanism here, and the same on the pedal. If we'd like to tilt the bed with the side rail down towards us, we will have an alarm advising us that the side rail is down. So that we can tilt the bed towards us with the side rail down, we would need to enable this function by pressing the mode and mobilization button together. We can then tilt the bed towards us. As a very visual learner myself, it helps me to understand the movement of secretions in the lungs if I can visualize it. So the ball bearings in the bottom of the lungs here help me to see that when the patient is repositioned side to side, those secretions will move because of gravity in the bottom of the lungs. To help your patient for their rib cage to come up and out and the diaphragm to lower, it's useful to put them into a full chair position. We'd do that using this button. So in summary, our 5 facts are to increase tidal volume, maintain residual volume, reduce respiratory tract infections by repositioning the patient using the lateral tilt, and also allow great diaphragmatic excursion by putting the patient into a full upright chair position.